articles like this being published that the patient would go to the doctor and ask to get the blood level of 25-hydroxyvitamin D. And of course, the doctor refuses, but the patient persists. And now the doctor's got religion because the patient is now all of a sudden had the blood level drawn and found to be deficient. And so, like I said, the assay for 25-hydroxyvitamin D is the most ordered assay by doctors in the United States. So how do you make your vitamin D? When you're exposed to sunlight, it's the precursor of cholesterol in your skin, absorbs that ultraviolet light, making vitamin D. But one thing you'll never have to worry about in the summertime if you're going out on vacation is you will never make too much vitamin D because sunlight cleverly destroys any excess. So you can never become toxic from sun exposure. Is it any better to be exposed to sunlight, and is that vitamin D better than the vitamin D in a supplement? When you make it in your skin, it lasts 2 to 3 times longer in your body than when taking it as a supplement, which is one of the reasons we often recommend taking a supplement every day. In 1931, the US government sent this brochure out telling parents to put your children outside to get some sensible sun to prevent them from getting rickets. But in this day and age, people worry about skin cancer. And indeed, for 40 years, we've been taught by the dermatology community you should never be exposed to one direct ray of sunlight because of its damage to your skin. Europe banned all vitamin D fortification, and that ban remains on the books today. But we believe that it's likely that these children had a rare genetic disorder called Williams syndrome, infancy, they have heart problems, mental retardation, and they have a hypersensitivity to vitamin D. And so it's still banned in Europe and throughout most of the world. 7-month-old female, muscle weakness, seizures, and a calcium half normal. And it turns out it's the first lowland gorilla born in captivity at our zoo in Boston and about to die. Seen by the pediatrician, given 400 units of vitamin D. Didn't do any good. They called me, and I got to see the infant. Infant has classic wide epiphyseal plates, classic for vitamin D deficiency. So what do? I treat aggressively, 5,000 units of vitamin D a day. And in fact, I was a guest of honor for her first birthday. Message, Mommy, will my growth be stunted? If you went to the zoo to see her, just because of her first few months of life of vitamin D deficiency and in utero vitamin D deficiency, her growth was permanently stunted. We estimate globally, in Europe as well as in the United States, more than 50% of infants that are born today are born in a deficient or insufficient state. In 1889 in Boston, rickets was common. Is it a problem today? You better believe it. Why? Because there's this concept out there that human breast milk will provide the infant with all of his or her nutritional requirement. It will not. There's essentially no vitamin D in human breast milk, about 25 international units in a liter of human breast milk. So if you give your infant as sole source of nutrition, human breast milk, that infant will be vitamin D deficient for that period of time. So we did a study at our hospital, 40 mother-infant pairs, and we very carefully analyzed their intake of multivitamin and milk consumption. They were taking 600 units of vitamin D a day. This is the amount of vitamin D recommended by the Institute of Medicine for all women of this age group, including pregnant women. And we reported 76% of moms, 81% of newborns were vitamin D deficient. Why should you care? Because we went on to show that preeclampsia is associated with vitamin D deficiency. Because vitamin D is critically important for muscle function, which of course is important for the birthing action. And so we did a study in over 200 women at our hospital and asked the question, association with vitamin D deficiency and need for primary cesarean section. And the probability decreased by 400% just by being vitamin D sufficient at the time that they gave birth. But we're telling all pregnant women they should be on 2,000 units of vitamin D a day, along with their prenatal vitamin, and to get some sensible sun exposure. How much does a lactating woman need to put enough vitamin D in her milk to satisfy her requirement? Bruce Hollis and Carol Wagner showed 4,000 to 6,000 units a day. Indeed, pediatricians have been paranoid about vitamin D toxicity, but even the American Academy of Pediatrics recommends that all infants from the time they're born need 400 international units of vitamin D a day, especially breastfed infants. Indeed, in Canada, they recommend up to 800 units a day. For pregnant and lactating women, 2,000 units a day. 25-year-old female, poor dentition, dental caries, tooth eruption. Turns out a major problem for non-human primates. But it also turns out that one of the major Centers of Disease Control prevention report, dental caries is the most common childhood disease in America, 5 times more common than asthma. And it was demonstrated that there's an inverse relationship with maternal vitamin D status and the amount of decay in infants after they are born. Also, periodontitis is a major issue, and it turns out that a study from the National Health Survey showed the higher your vitamin D status, lower is your risk for periodontal disease. Fertile couple from Indonesia, they show up in Washington, D.C., and they had non-viable offspring. This was a major PR problem about 3 decades ago. Why? Because there were no Komodo dragons in any zoo in the United States. And Sukarno from Indonesia visited Nixon and brought a mated pair of Komodo dragons. And so they mated, and they had non-viable hatchlings. I said, well, they have a hormone problem, but not the kind you're thinking about. They're in a glass enclosure, and they cannot make any vitamin D when you're exposed to sunlight through glass. And I said, I'll bet you they're vitamin D deficient. And sure enough, when we gave mom and dad vitamin D, all of the eggs hatched the next go-around. Vitamin D deficiency is associated with low infertility, low birth weight, and poor birth outcomes. And so what you want to measure, of course, is 25-hydroxy-vitamin D. Never order the active form of vitamin D. Indeed, it's the barometer for vitamin D status. And so the normal range, typically from a lab, is 50 nanomoles per liter up to 250 nanomoles per liter. So often, though, you have an H coming back, especially if you have somebody that went on a sunny vacation in the summertime. The question is, are they intoxicated? And so if you have a level of 120 nanograms per ml or a little over 270 nanomoles per liter, right, are they vitamin D intoxicated? I don't think so. No. You don't even have to begin to worry about intoxication until you're over 375 nanomoles per liter. But what about that lower range? How do you know if you're sufficient? And so we and others have done studies. This is one study that we did throughout the entire United States in postmenopausal women. And we looked at their PTH levels when they began to plateau. And they begin to plateau at around 75 nanomoles per liter. And we also looked at secondary hyperparathyroidism, and they had a 3 times higher risk of having an elevated PTH compared to being above 75 nanomoles per liter. And we looked at the diurnal variation, and we showed, on average in the United States, in wintertime, it's about 47.5 nanomoles per liter. And that in the summertime, it goes up to about 65 nanomoles per liter. And that if you live further south, that peak is still the same, but the nadir is a little bit better. That there's a 4-week lag time before the PTH levels peak at the time when your 25-hydroxy-vitamin D levels are at their lowest level. A study of 675 German healthy adults, ages 20 to 90 years of age, that died in some type of accident. And they wound up getting their blood as well as their bones. And they showed typically many had normal bone mass, but some had very low bone mass, osteoporosis. But some had normal bone mass, but a lot of this pink stuff. This pink stuff is known as osteoid. It's a classic sign for vitamin D deficiency bone disease. And so the study authors suggested to guarantee sufficiency, you want to have a blood level of at least 75 nanomoles per liter. So these otherwise healthy German adults didn't realize it, but they had underlying metabolic bone disease due to vitamin D deficiency. Look at the data very carefully. You could see 24% of healthy adults between 52 nanomoles per liter had evidence of vitamin D deficiency, bone disease, and 0 if you're above 75 nanomoles per liter. You assume you're having a healthy diet, you're getting all the nutrients that you need. There's essentially no vitamin D in your diet. Indeed, even in the United States, where food is fortified with vitamin D, no child or adult can get enough from dietary sources. 0%. So sun-dried mushrooms is a good source of vitamin D. And in fact, Some in Australia and in the United States are now irradiating mushrooms and providing them on the produce section in the supermarket as a source of vitamin D. But back in the 1940s, right, they used to have kids line up for cod liver oil because it tasted so good, right? We don't do this anymore. And it comes in tablet, oil, and an emulsion. It's only oily fish, salmon, mackerel, herring. How much do you have to eat? You'd have to eat it every day. There's only 500 to 1,000 units in a serving. Indeed, we went on to show that wild-caught salmon, whereas farm salmon have hardly any, wild-caught salmon have plenty of vitamin D. So if you're going to get your salmon, make sure it's wild-caught if you want your vitamin D. This is where we're getting our vitamin D from casual or not so casual exposure to sunlight. It provides us with our vitamin D requirement. Out there in the summer, feeling great, making lots of vitamin D. What about in wintertime? So guess at what latitude you basically cannot make any vitamin D in your skin. If you live above Atlanta, Georgia. So guess what? Living here, you basically cannot make any vitamin D in your skin from about mid-October until the end of March. It's from 10 a.m. until 3 p.m. Even at the equator is when you make your vitamin D. That whole body exposure, SPF of 30, reduces your ability by 98%. Right? 90 to 95% of your vitamin D is coming from sensible sun exposure. So how much? Well, you never want to burn. If you get the RDA of 1,500 to 2,000 units a day, if you expose 15 to 20% of your body's surface 2 to 3 times a week, it will satisfy that requirement. We took up some elders, wheeled them out on a veranda, and exposed them to sunlight, and showed that 15 to 30 minutes significantly raised their blood levels. The higher your BMI, lower is your 25-hydroxy-vitamin D level. In fact, we went on to show that if you take a normal weight and an obese individual and expose them to ultraviolet radiation or give them an oral dose of vitamin D, they only raise their blood level by about 45%. And so we now know that obese people need to take 2 to 3 times more vitamin D than a normal weight person to satisfy that requirement. Now, Pele here with his girlfriend, he has to be outside 4 to 10 times longer because he has a natural sunscreen. Here in pediatrics, if you use 75 nanomoles per liter as the cutoff, children 6 to 11 years of age, 70% were vitamin D deficient. So if you look globally, and here in Europe, 57 to 64% on average, vitamin D deficient. Precipitating osteoporosis is a silent disease. And so as a result, you don't know it until these patients fracture. Turns out, generalized bone pain, isolated bone pain, muscle aches and pains. The nouveau diagnosis, of course, is fibromyalgia. Most of these patients that I see in my clinic are vitamin D deficient. And most of them that I treat with vitamin D have dramatic improvement in their symptoms. Here, Mayo Clinic proceedings in Minnesota, Plotnikoff reported of 150 children and adults presenting with aches and pains in their bones and muscles, 93% were vitamin D deficient. Right? We have a vitamin D receptor in our skeletal muscle. And we did a study and showed in nursing home residents, 72% less falls for patients that were on 800 units of vitamin D a day for 5 months. 200 and 400 was of no benefit at all. Right? No question. You want to be at least 75 nanomoles per liter, good for muscle strength, bone mineral density, reduce risk of falls, improve your bone density, less likely to fracture. Now, how do you treat vitamin D deficiency? Right? A major issue. So you could take a multivitamin, but there usually is only about 400 units. So how many are you going to take? Well, you can't take too many because you're going to choke on them. And also, you get too much vitamin A. You can only take 1. And so when your tank is on empty, you get a liter of gas. No, you fill it up, right? And so what we typically do in the United States, because we have a 50,000 unit dose, is I give 50,000 units once a week for 8 weeks. Fill up the tank. It's equivalent to about 6,500 units of vitamin D a day. But now the docs are doing this, and then they put them on 1,000 units of vitamin D, and they come back 6 months later deficient again, and they wonder why. Well, it turns out that you have to put them on a higher dose, right? And so I put them on 50,000 units every 2 weeks forever. That's equivalent to 3,000 units of vitamin D a day. Now, you may argue, right, it's fat soluble, going to build up in your body fat, may work for a couple of months or a year, but what about long term? Are you going to worry about toxicity, right? And we showed and published in Archives of Internal Medicine in 2009 our patients on an equivalent of 3,000 units a day for 6 years, levels on average 100 nanomoles per liter, and there was no toxicity. So Bruce Hollis and Carol Wagner did a study looking at infants and toddlers. And also, Catherine Gordon showed 2,000 units a day, 50,000 units a week for 6 weeks was perfectly safe. Right? Pregnant women, Bruce Hollis and Carol Wagner showed that if you give pregnant women 4,000 units a day, you could raise their blood level to 125 nanomoles per liter. There was no toxicity. Serum calcium was perfectly normal. The most sensitive indicator, of course, is if there's an increase in urinary calcium excretion. There was no change. 1,700 have a blood level above 125 nanomoles per liter. A very small percentage have above 250 nanomoles per liter. None of them had any evidence of toxicity. But you can become toxic because those that had blood levels that were way above 900 nanomoles per liter had a calcium of 17 mg%. So vitamin D is very safe. And you don't have to worry about taking a supplement and going out into the sun and even eating salmon every day. You will not become vitamin D toxic. And indeed, we also know, of course, that vitamin D is a hormone because it's made in your skin, goes to your liver, and then to your kidneys to get activated. But curiously, not only are your calcium-regulating tissues containing a vitamin D receptor, but every tissue and cell in your body has a vitamin D receptor. Why would they be there if they weren't having an effect? First study was done in 1979 by Dr. Tetsuo Suda. He showed that leukemic cells that had a vitamin D receptor, if you incubated them with the active form of vitamin D, they became normal. So this introduced the concept that maybe improving your vitamin D status could be of benefit in reducing risk for cancers. That if you just give a person 1,000 units of vitamin D a day, potentially could reduce risk of colorectal cancer by about 50%. Out of the Nurses' Health Study out of Harvard showed nurses that had the highest blood level, on average of about 125 nanomoles per liter, 50% lower risk of developing breast cancer. Also, Bob Heady's group showed women taking 1,100 units of vitamin D a day reduced risk of all cancers in 4 years by about 60%. That prostate cells actually could activate vitamin D. And we went on to show, and many others have reported the same, is that many cells in your body have the capacity to activate vitamin D, regulate a whole host of genes, and then induces what's called the 24-hydroxylase to destroy it. So that as soon as it enters a cell, it begins the process of it destroying itself, but in the meantime has a lot of beneficial health effects. It's estimated up to 2,000 genes are directly or indirectly regulated by vitamin D.